The title of my project is The Effects of Interactive Learning Strategies on Clinical Performance Among On-Campus Junior BSN Nursing Students. First-year junior nursing students tend to have more difficulty utilizing reflective reasoning, which would involve analyzing and making judgments concerning clinical experiences. Reflective reasoning is a crucial component of the critical thinking process. Understanding connections between patient data, priority setting, and providing safe nursing care. Through the evaluation of different active learning methods, nursing faculty would be able to identify gaps of knowledge regarding students' clinical performance, along with improving the cognitive process of learning and student success. Therefore, the purpose of this project is to determine the effects of active learning methods on the application of theory to clinical practice. Additionally, the use of active learning strategies could result in the implementation of pedagogic changes in order to enhance student engagement and retention of course content, as well as the connection between theory and clinical performance. The theory identified for this project was KOLB'S theory. According to Kolb, learning is the process whereby knowledge is created through the transformation of experience. Here for you, I have identified the 4-stage cycle of experiential learning because that's what we do in nursing. There is a didactic portion, but also one in which there is learning through experience, as in our clinical lab setting and in the hospital setting where they take care of real patients. But with identifying these 4-stage cycle, one would be concrete experience, which involves having a concrete experience in which learners determine how they feel about the experience. Secondly, reflective observation is the observation and reflection on that experience, which may lead to how learners approach a specific skill. So, in other words, learners watch a skill being performed, and that's what we do in nursing. We show them the skill that they are to learn, and then they do their observations, and from there, develop what they need to in regards to how they feel about the skill, but yet then performing, being able to do the actual performance themselves. But abstract conceptualization is where the learners then analyze and form conclusions about the learning experience. So here, in reality, what do they think about the experience? Once we give them the information, then what do they actually think about the experience, approaching it? But then lastly, active experimentation is where the learners apply the knowledge they have attained, which leads to new experience, such as the performance of the new skill or performing a new clinical skill. Active learning methods used in the classroom are virtual interactive simulation, known as VSIM. This is where the students are given an assignment to complete, and it is based on a actual patient situation, but they complete by following the instructions. Then they have a person that they are at the bedside caring for, and they must follow through with different components of the simulation in order to acquire a specific score, which determines how well they were able to understand from their readings and from what they were taught in class and apply that to their clinical practice. But also, In class, we've used game-based learning activities, so different class times we've used Kahoot as a game learning activity for the students in regards to nursing concepts that they have been taught. However, in the clinical lab setting, students complete patient simulation scenarios, whether it is the computer-driven high fidelity scenarios or if they have used the standardized patients in which they do their medication administration lab. But as for the computer-driven simulations, the students are given objectives on 2 patients, and they don't know which patients they're going to be having at the time, but one of the patients are diagnosed with chronic obstructive pulmonary disease, or COPD, and the other patient is admitted with a leg fracture. So the students take this information, they receive a report just as if they were coming in for a shift at a hospital. And from there, they go into the patient's room and provide the care based on the information that they have been given, as well as the objectives for the learning activity. Then in the medication administration scenario with the standardized patients, they have been given a complete chart to review, and that includes the history, the physician's orders, and the list of medications. So it gives the students time to come together and develop a plan as to how they are going to approach these patients. And with this scenario, they have to provide care by administering medications to 4 different patients. In the evaluating of the student's clinical performance, data for each active learning method will be analyzed to determine the overall effects of the student's clinical performance. However, due to the organization of the course content, the learning experiences for this Junior 1 nursing course data are currently being collected and analyzed. But these are based on the computer-driven high fidelity simulation and the medication administration simulation evaluation methods, or the clinical performance that's being assessed, are based on those 2 components. However, preliminary results, as I have mentioned, for clinical performance reveal that first-year junior nursing students have challenges with identifying patient health issues with regard to healthcare prioritization, assessment findings, and demonstrating the proper procedure and or usage of equipment when administering injectable medications such as heparin and insulin. But in the early phases of this project, it was identified that students, although they were able to grasp some key concepts cognitively, there still is a gap there in relating the knowledge or applying the knowledge then when they were actually at the bedside caring for a patient. So with regards to key concepts related to patient-centered care and nursing practice, there still is some challenges in being able to perform. Whether there are other variables involved, the students still were having some challenges in the areas that I did previously address. Even though this project is in the early stages or preliminary stages, the findings obtained at this point have been useful. And this has been useful in identifying how possibly interactive educational strategies could be used for improving performance. So that way, nursing faculty will be able to take this information and be able to establish when and what should be taught at different points of the course, so those gaps could be bridged and students would be having more effective performance at the bedside. But learning analytics, though, quantify the impact on student learning as well as provide data concerning the application of key concepts to clinical practice, which in turn could aid nursing faculty with implementing strategies that would enhance clinical skill development in junior level BSN nursing students. Additionally, the development of structured debriefings after the simulation activity could potentially engage students in learning, leading to improved clinical performance. Because what I discovered was from the debriefings that were performed, in some instances, the structure may not have been as consistent and could be more so in order to get the students involved in the learning so that when the skill is repeated or could possibly, maybe that is something that could be done, repeated at a different time and acquiring maybe summative findings to see indeed how well now that bridge has been gapped after speaking about the challenges that they had during the actual scenario. This concludes my presentation, and I would like to thank you for your time and attention.